Hi, Geri Lynn.
Hi, how are you?
Where are you right now?
I am right outside of Philadelphia right now. It's a miserable day here. There's a lot of rain and it's kind of gloomy, so that definitely doesn't help the situation.
Yeah, I'm in Florida, and as you can see, I'm not wearing a shirt as always, and we got palm trees behind me.
Yeah,
Uh,
you should stand up and give all the viewers a full view of the shirtless.
yeah, soon. Few months. Let me get back in shape.
Okay.
So I'm really happy to have you here because you are a doctor of psychology, clinical psychologist, right?
Yeah, that's
Yeah.
right.
I'd love for you to give my audience a little bit background about who you are and what you're doing.
Yeah, so I am a clinical psychologist. A lot of the work that I am currently doing is working with medical doctors, providing them education on the disease of addiction, specifically opioid use disorder, alcohol use disorder. So I work very closely with the medical community to provide them with psychological education about psychiatric illnesses.
Oh, that sounds pretty serious stuff.
Yeah.
Wow, crazy. And you have your own private business right now?
Well, most of what I do is working for a pharmaceutical company in
Right.
medical affairs, educating medical doctors on different on medication for opioid use disorder.
Cool. And am I right that you have a book coming out?
Yeah, I do have a book coming out. It's called Mainlining Philly, and
Nice.
the book is about really my personal life. So what kind of got me into the field of psychology is my family. They struggled a lot with polysubstance abuse, a lot of drug abuse issues, and psychiatric illness, both my parents. And I kind of grew up in a crazy, wildly dysfunctional household and share that personal story about how I kind of beat the odds and got out of that situation. And then also kind of conceptualize it from a psychological perspective. So it's a very interesting read. The book comes out April 14th.
Awesome. What we'll do is we'll put a link to your book in the description of this video. So if anybody
Awesome.
wants to check it out, you guys can go check out her book. I'm definitely going to buy it because I want to read your story and hear about that. So congrats on the book.
Thank
So
you.
what I wanted to talk to you about today was this. Obviously, coronavirus is the biggest topic right now in society.
Yeah.
And I was watching a lot of the press conferences, and there was this expression they were using where they were saying the cure is worse than the virus. And I think what they were referring to is if we keep people out of work too long, not only can it crash the economy, but it can also leave a lot of people in financial ruins. And I think even President Trump said that based on some of their modeling, they're worried that people are going to start turning to drugs to try to cope with the situation. So my question is, what are your thoughts on this overall situation we have right now?
Yeah, so just from a mental health perspective, in addition to people being concerned about their physical health, you're going to see an exacerbation in mental health issues. So, you and I probably consider ourselves normal, without any significant severe mental illness. And even for people like us, there's times when throughout a day where your anxiety level through this may spike, and you may 1 minute you may say, I got this, like I can do this, I have enough food, I'm healthy, like I have this. And then literally minutes or hours later, you may start to get in your own head and your self-talk is telling you, you're feeling panicked, you get anxious, you get a little blue because you're isolated, you're not getting to interact with friends and family the way you used to. So the first thing is just normalizing that. Like those mood fluctuations are very normal, and it's okay to feel that way. The second thing is, as far as people who are considered a vulnerable population, somebody who may already have been suffering from depression or anxiety or is in recovery from drugs and alcohol, they are more vulnerable during a time like this because their coping strategies have always been to use when they feel overwhelmed. And this is a very overwhelming time for everyone. So it makes them more vulnerable to, hey, listen, I'm going to have a drink, or I'm going to use, or I'm going to relapse because I can't deal with what's happening around me. I have no control over what's happening in the world. And you kind of get anxious and you use. So those folks are exceptionally vulnerable right now. So it's important to tap into resources. So if somebody liked to go to Alcoholics Anonymous or Narcotics Anonymous or Smart Recovery, these are just some 12-step fellowship programs. They happen in person a lot of the time, and you make that connection. What a lot of these programs have done is they've gone online. so you can actually still, participate in a smart recovery meeting online or an AA meeting online, so you can connect with sober supports. The other thing that I've noticed too is consumption of media. I think it's great for you to check throughout the day, media outlets, get what you have to get, and then turn it off. If you're constantly looking at it all day long, it's going to elevate your anxiety level and your fear level. So, depending on very resourceful and credible sources, like checking in with the CDC website, looking at your local county website, things like that are helpful just for you to get the facts and then move on. Because keeping that incessantly on all day long is really going to make anyone feel anxious and scared and worried at times.
Yeah, I mean, last night I was having like an allergy attack for some reason. I don't know, maybe I went to the pet store and I interact with cats. I started getting a little nervous, like thinking, is this coronavirus? Do I have coronavirus? And it definitely gave me some difficulty sleeping last night. But, ultimately I'm a pretty logical person, like you said, we're I guess normal, right? So I was able to fall asleep, no problem. But my question is, I have a lot of friends who have been calling me and messaging me saying, Adam, I'm feeling really anxious about this. Talk me down from my anxiety. What would you suggest for someone who's going through a panic attack or someone who does have general anxiety about this coronavirus?
Yeah, so, one of the first things, like I said, is limiting your exposure to media outlets. The second thing is there's some really cool apps out there, and I use them myself because I'm getting anxious during this time. I have both kids at home. If you see a young child come behind me, it's probably one of my kids, and I'm trying to work. But there's a really cool app that I use. It's called Headspace, and it's you can download it on tablet, on your computer, on your phone, and what's cool is it'll walk you through mini meditations. And you may, in the course of a day, you don't have a half hour to fully meditate. There's 5-minute meditations, 8-minute meditations. They help you work on your breathing. So you can literally lie down in your living room floor for 5 minutes, listen to a meditation, and what it does is it helps you breathe and it calms your nervous system down. So if you can engage in something like that for a few minutes, you will feel better. Another thing that is great too is exercise. Now, for somebody who has a history of anxiety, you have to watch the level of exercise. So you want to do moderate exercise. You don't want to over exercise because that can exacerbate your angst. So this is what I do too. What I've been doing is I will wake up early in the morning and I'll get a 45-minute workout in. This morning I woke up and I felt especially antsy, a little anxious. It was raining again here today. I couldn't go out and do my normal walk outside, and that's the third day in a row this has happened. So I got up and I worked out for 45 minutes, and after I worked out, I felt like I could breathe. So exercising 30 to 45 minutes a day, whether it's to an exercise video in the house or whether you're walking outside would be preferable. Engaging, doing different applications, like the one I like is Headspace. There's also these little things I've been
Is this Headspace?
Headspace. That's it. Yep. See those cute little, hold it up a little bit, Adam, those little balls? Yeah, those little balls, they have these really cool things where you can follow them and they inflate and then they deflate, and they do it to the rhythm because they want your breath to mimic that, so it slows down your breathing. So
that's really awesome.
Yeah, there's really cool stuff that you can do to kind of check in with yourself. Yeah.
I will put a link to this on my on the video. We'll put a link to Headspace.
Okay, awesome.
They should be paying you for this.
Huh? They should be given. Yeah, I mean, I've talked about Headspace so much since this started. It was kind of like my little secret. I used it. I would use it at the end of a workout at the gym, and just to calm down after a workout. And it always worked wonders for me. I just really like it. So doing things like that. When you talk to friends who are going to be a distraction, that are going to make you laugh. Like, that's why you probably have all these people calling you Adam, because you're such a free spirit and you have a good energy. So when they call you, if you talk to them about anything else other than COVID-19, that's a good thing. You want to be distracted, you want to laugh, you want to connect with friends that can decompress you, not friends that are going to escalate your anxiety. I have some friends that I love dearly, but those that are like conspiracy theorists and they want to talk all the time about, COVID and what's going to happen next. And I myself, for my own mental health, I kind of don't engage them much because I don't want to exacerbate my own anxiety.
Awesome. Yeah. I will admit, when this virus first hit in Thailand, we heard about it in January. It was a bigger deal in Thailand because Thailand borders China. So it arrived there first. And I definitely put up a few conspiracy theory videos back then. Yeah. Since then, I realized I've kind of moved away from that because I realized it's really not that useful, especially for someone, if majority of the population isn't anxious, they don't need to see conspiracy video theories.
Right.
I think that's like for a specific type of person who just like wants that kind of content.
Right.
Now what I'm trying to do is I'm trying to do videos like this, where I can actually answer questions with professionals, licensed professionals. So far I actually interviewed a person that tested positive for coronavirus, spoke about her experience. I spoke to a guy in Bangkok just to see how Bangkok's dealing with it. I spoke to a nurse, a nurse practitioner, to ask her how her hospital is dealing with it. And now I'm talking to you, a licensed, also health professional. So I'm trying to go more in the credible types of interviews. And I think that this is a lot more useful for people than it was a bioweapon. Ooh, that stuff is just that can cause anxiety for a lot of people.
Yes, no, it totally does. And I get my quick facts, and then I kind of go off the grid. And other health grades came up with a really cool thing too. If you text the word corona to 83973, health grades developed it. Health grades is, it's backed by physicians. And if you were to text that to yourself, corona to yourself, to that.
Here we go.
Yep.
Welcome to health grade.
Yeah. And then you put your zip code in. It'll give you local resources and credible updates about corona in your area. So that's another thing where you can get your information, and then you don't have to worry about, going to CNN or any of the major outlets to exacerbate your angst. You can get your facts right then and there.
Do you think that a lot of the not the media, because I got in trouble for saying the media,
yeah,
but I'm going to use that. Do you think that some of the media is guilty of trying to hype it up and create fear? Do you think so? What's your opinion on that?
I think that in general, the media's job is to provide information and make things provocative, and
that's the word, provocative.
Yeah, draw people in. Whether or not it's appropriate, I don't think that's for me to say. But I do think that provocativeness sometimes during a time like this, this is a global pandemic. It's not every day or every decade or even in a lifetime that you're up against a global pandemic. In certain situations, that may have a counter effect on somebody's mental health and even their physical health. Because the other thing you want to think of is, you mentioned it, you can become psychosomatic. So like if I sneeze, I'm going to be like, oh my gosh, do I have, is this the beginning of COVID-19? So that's the other thing too. Like people will start to, internalize things in their head, and it may be expressed physically. So they may have some GI issues, and then they're running to the bathroom because they're anxious and they're upset, or it may drop their immunity to make them more vulnerable because the fact that their nervous system is hyperstimulated. So that's another thing too, that while it's so important to manage your mental health, because you don't want to misconstrue every sneeze or every clearing of the throat as, oh my gosh, I have COVID. So it's just really important to stay in touch with your body. But if you keep your mind healthy, you'll be able to read your body better, if that makes sense.
Yeah, that makes absolute sense. And the nurse said something similar along the lines that I interviewed yesterday, and she said it is important to keep your body healthy. So in case you get coronavirus, you can definitely withstand the virus more. So she said things like, don't smoke, because smokers are more vulnerable to this disease because it's a respiratory illness. That's how it kills people. Yeah. So you're saying something along the same lines of you need to have a clear mental space, and you need to be healthy mentally, because then you can keep your immune system strong too. So I think that's important for my audience to see, is that it's not just about your body and going to the gym and exercising, but it's also making sure that your mind is clear and that you're not being burdened by all this, negative news and everything. So I think that's helpful. Can you still hear me?
Yeah.
Okay, cool.
Yeah, I can hear you.
Awesome.
Yeah.
So that's definitely great insights, and I appreciate that.
Yeah.
Very cool. Well, I think this was really, really awesome. Do you have any closing thoughts you want to share with my audience?
No, I just think the main thing is, listen, I'm a mental health professional. I went to school for 1 million years, and I'm winging it. Every day, myself, I'm winging it. Sometimes, in the course of a day, I can feel great, and then sometimes I cannot feel so great. So I just really want people to know that you're not alone, that it's okay to not be okay, and that the main thing that you want to do is just, practice your self-care, because there will be times where you lose your temper or where you may feel anxious. And if you can just stay in tune with yourself, put yourself in timeout. Like, I literally will put myself in timeout. I have a husband and 2 kids, and I'm like, I just need 10 minutes. Just give me 10 minutes to kind of pull myself back together again. So giving yourself timeouts, knowing that this is normal and normalizing your mood fluctuations, I think will help your audience a lot, because some people might think like, oh my gosh, what's going on with me? I'm going crazy or something. No, you're not. We're all in the same boat. So just normalizing those feelings, and then also reaching out to your local resources. No matter where you are in the country, if you go to the county you live, if you go onto the county website, they do offer local services. Like, you can call in for mental health hotlines. The other thing is, if you have insurance, look on the back of your insurance card and call in and say, hey, listen, I'm feeling really anxious, I'm overwhelmed, I don't feel good. Can you put me in touch with a health provider, or I can do therapy online? So your medical card, there's other websites like BetterHelp and Talkspace, where you can try to get that one-on-one.
I've seen Talkspace. Yeah.
So, I think that's some of the last things I'll leave you with. And then for those of you who are in recovery from drugs and alcohol, try the virtual meetings. Try to go on Smart Recovery. Try to go on, AA has teleconference meetings where you can call in. Still work your program. Right now it has to be adapted, but still work your program and surround yourself. Try to surround yourself, even if you're trapped at home with somebody who may be slamming back the booze. Try to interact with people who are sober and who are trying to work a sober program if you're somebody who's in recovery. That's
awesome. Yeah, my friend is actually a recovering alcoholic. I think she's been sober for about 3 to 4 years now, and she always told me how important those meetings are to her, and how they keep her honest and they keep her accountable. So I'll definitely check in with her and see how she's handling this, because this could be a good time to just check in and say, how are you, doing and coping with the virus? She seems to be doing okay based on her Instagram, but we all know that Instagram lies a lot of the time. I think you know that better than any of us.
Right. Well, you can bring her on. Maybe she can share some of her healthy coping strategies.
Awesome. Yeah, we did. I interviewed her last year, but I did it as a written interview. I'm moving now more towards these YouTube interviews, so maybe I could bring her back and do that.
Awesome.
So what was the name of your book again? Tell my audience.
Oh, the name of the book is Mainlining Philly.
Mainlining Philly.
Yeah, Survival, Hope, and Resisting Drug Addiction. And it comes out April 14th.
Very cool. I'm very excited for the book, and congratulations on all the success in getting out of media.
Yeah, I know. I think I might have added a couple years to my life. If not, then I've definitely subtracted it, because mental health is not an easy field, but it's one that I love.
Awesome. That's great to hear. All right, Geri, thank you so much for the time today. I really appreciate it.
All right, thanks, Adam. Take care.
All right, bye.
Bye-bye.
Hey, guys. BeFreeMySheeple.